Thank you for joining us for this segment of Live Healthy. I'm your host, Lauren Collar. And joining us today, we're going to talk about women's health with Dr. Heather Schwartzberg, an OBGYN here at Somerville Medical Center. Thank you for joining us.
Hey, Lauren, thank you for having me. I appreciate it.
Today, we're going to talk specifically about birth control. There are so many options out there now.
You know, Lauren, there really are. For women who are just not ready to have their children yet or want a hiatus in between having their babies, we've got lots of really good options that are either in the short run or for longer term contraception. So it's been really, it's good. Over the last decade, a lot of options have come out in the market and become more popular and more affordable for women as well.
How do you decide which method is best for which patient?
You know, it depends, first of all, what her plan is. You know, whether she already has children or whether she is not yet at a point of her life to start a family. So that's one thing. You know, the second thing is, I think, the length of time that she wants to have contraception for, whether it be just for 6 months or a year, or maybe she has a set of twins and she thinks she might be done but doesn't want anything permanent. That would be kind of pushes in a different direction.
So what would your advice be if a woman is considering birth control? What steps should they take?
Well, you know, you always have to think about also where a woman is in her life if she's at a risk for infection. The use of barrier methods, always not just for contraception, but for keeping your body healthy and for preventing disease. So those are always an option that we talk about for any woman, especially who's not in a monogamous relationship. But for those that are, then you start to think about things like different pills, patches, there's vaginal rings, we have implants that can go in your arm and be hidden. There are the a depot shot that you can get every 3 months, and then there's also even a longer term use such as an IUD, and there's several options among IUDs you can use as well.
Any side effects associated with birth control methods?
Oh, yes. You know, as women, we always will talk about side effects of any medication, and some women are very sensitive to medications. And we all hear about things like weight gain or headaches, breast fullness, you know, queasiness, and some options do have more side effects than others. So it kind of depends on what you want to do to what kind of side effects you have. So things that are oral will often be accompanied with more nausea or like those things like headache and breast tenderness, while some of the things like an IUD can be associated with more cramping, especially when it's first placed, but that subsides. Side effects typically within a few weeks will go away.
Okay, thank you so much for being here today.
Thank you for having me.
Thank you for being here for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.